Hello, we're going to talk about uh, skeletal cartilages as well as bone. Now, in skeletal cartilages, there are no blood vessels or nerves. They do have a dense connective tissue perichondrium that contains blood vessels and nutrients for nutrient delivery to the cartilage. Hyaline cartilage is the most common type, provides support, flexibility, and resilience, and it's also the precursor to most bone. Elastic cartilages are very similar to hyaline cartilages, but they have elastic fibers. Fibrocartilages contain collagen for great strength. Here we have our axial skeleton and our appendicular skeleton. And as far as the cartilages go, see here in your ribs, you have hyaline as well as the end bones for your articular cartilage. Fibrocartilages, the menisci of knee. Fibrocartilage is also going to be present in the intervertebral discs. And elastic cartilage, a good example, is in your ear to keep it popping back into shape when you bend it. Now, growth of cartilage, appositional growth, it secretes matrix against the external face of existing cartilage. Interstitial, it grows from within. Calcification occurs during normal bone growth as well as in old age. Okay, skeleton bones are divided into two basic parts, the axial and appendicular skeleton. See, the axial is in brown, the appendages are the appendicular skeleton, and this does include the girdles, which includes the pelvis as well as these areas up in the scapula and such, clavicles. Okay, names of bones. The humerus is a long bone because it is long. The sternum is a flat bone because it's flat. Vertebrae are irregular bones because of their irregular shape. And then the talus, as well as the other bones of the carpals and tarsals, are short bones. Bones support, protect, and allow movement. They're also for storage of calcium and phosphorus, for hematopoiesis, and also for triglyceride or fat storage in cavities. The bulges, depressions, and holes in these bones serve as a site of attachment for muscles, ligaments, tendons, joint surfaces, and also holes for vessels and nerves to go through. Compact bone is the dense outer layer, and then spongy or cancellous bone is a honeycomb of trabeculae. Now, trabeculae means honeycomb-like stuff. Now, we'll look into the picture of these parts, and I think it will make more sense. This is the diaphysis of the bone. It's the shaft of the long bone here. You have the epiphysis is this area up here, proximal and distal epiphysis. The epiphyseal line is here, your growth line, and it was a growth plate, and you have them on both ends of the bone. Periosteum is the outer layer here. The endosteum is the inner layer here. This is going to be spongy bone, articular cartilage. This is going to be compact bone here, on the very outside here, here. Okay, periosteum contains, it's a fibrous connective tissue outer layer. Inner is osteogenic layer. Osteoblasts form bones. Osteoclasts break bones. Osteogenic cells are stem cells. Now, osteocytes are not listed here, but they're mature bone cells. And the nerve fibers, nutrient blood vessels, lymphatics enter the bone through nutrient foramina, and they're connected to the underlying bone by Sharpie's fibers. Endosteum is the inner layer. It also has osteoblasts and osteoclasts. Now, here we have a picture. This is the periosteum, so it's ripped back here, Sharpie's fibers, perforating our nutrient arteries here. Yellow marrow, which is fat, endosteum here. This is compact bone. Okay, short, irregular, and flat bones have a periosteum-covered compact bone on the outside, endosteum-covered spongy bone on the inside. Spongy bone is called diploid in flat bones, and the bone marrow is between the trabeculae and flat bones. Now, when you look at the skull, compact bone, here is a spongy bone, the diploid. If you look here, see all the trabeculae, these are the honeycombs, and you're going to have marrow in between. Does not look like it's near as solid. It's not as solid, but it's very strong. Protects your brain. If we had no hollow spaces in bone, everything would be too heavy. Okay, hematopoietic tissue or red marrow. In adults, the trabecular cavities of the heads of the femur and humerus, and the trabecular cavities of diploid flat bone. Now, if they're going to take a sample or a donation for bone marrow donation for a transplant, they'll probably take it out of the ileum. They can take it out of the heads, the humerus or femur, but it's harder to get to. Red marrow fills up most of the medullary cavity and all of the spongy bone. Because infants have to have so much red blood cells, so many red blood cells made. Okay, now compact bone is made up of a haversian system, also called an osteon. This is a structural unit of compact bone. The lamellae are weight-bearing column-like tubes. Then it has the central or haversian canal for vessels and nerves. So here we have the lamellae for twisting force. You see collagen this way, collagen this way, collagen this way, and the canal for all of vascularity and nerves. Okay, perforating or Volkmann's canals are at right angles to the central canal, and they connect blood vessels with periosteum and central canal. Lacunae are small cavities that have osteocytes, and cannuliculi connect these. Now, I think there's a picture a couple of slides forward. Here we have, this is a lacuna with a osteocyte and cannuliculi connecting these. Here's our central canal with artery, vein, and nerve. And I'm not sure why that was out of order, but we'll go ahead and go back. You see, you have multiple haversian systems here. One here, one here, one here in your compact bone. Here's your periosteum on the outside, your endosteum, your spongy bone. Now, the perforating or Volkmann's canals are going this direction, whereas the central canal is going up and down this direction. Here's your Sharpie's fibers, and you can see, not as well as we could on the other picture, but your lacuna with the cannuliculi. Now, between these haversian canals, to fill in the space between the circles, we do have some interstitial lamellae. Trabeculi align across lines of stress. This is our spongy bone we're talking about. There are no osteons. Irregularly arranged lamellae, osteocytes, and cannuliculi, and then capillaries in the endosteum supply the nutrients. Okay, now the chemical composition of bone, we have the organic as well as the inorganic portion. Now, cells, we have the stem cells, osteoblasts, osteocytes, which are mature cells, and osteoclasts. Osteoblasts break down bone. Osteoclasts form bone. Osteogenic cells are the stem cells that all bone cells come from. And then the mature bone cells are the osteocytes. The osteoid is the organic bone matrix. and it's secreted by osteoblasts, and it has a ground substance made of proteoglycans and glycoproteins, as well as collagen fibers that give strength and flexibility. Hydroxyapatites are the mineral salts, 65% of the bone mass, mainly calcium phosphate crystals, and these give hardness and resistance to compression. Now, ossification or osteogenesis, look at the word genesis, means making stuff. Osteo means bone. So bone tissue formation begins in the second month of bone development, in the second month of embryonic development. Postnatal bone growth continues up into early adulthood. Bone remodeling and repair continues for your whole entire lifetime. Types of ossification: intramembranous ossification is for formation of your flat bones, cranial bones, clavicle, that type of thing, sternum. And you have actually membrane that develops, fibrous membrane, and the bone develops from that. Now, endochondral, look at the word chondro, means cartilage, cartilage is replaced by bone. So hyaline cartilage is a precursor to most bones. Most of the skeleton is formed by endochondral ossification. Now, it uses cartilage models, and you get breakdown of hyaline cartilage. Okay, this is around week 9. So the early fetal stage, we already have a bony collar forming around here. Now, this would be all the way around, just like a collar goes all the way around your dog's neck. The bony collar goes around and around the whole bone here. And we start to get, as you develop further, you start to get deterioration of the cartilage, and the bony collar continues to develop and get bigger, more breakdown, more bony collar. You're starting to get nutrient vessels coming in. By birth, you have secondary ossification centers here at the epiphyseal ends. And this will be your epiphyseal plates here in between cartilage. And here is your epiphyseal plate, child through adolescence. Now, if you take a radiograph of this bone, you will just see blank there. It will look like a fracture, so you need to be familiar with radiographs of children so you won't be mistaken. In adult, this will be filled in and just totally bony. Okay, grow longer, we get interstitial growth, and that's going from the epiphyseal plates. Appositional growth is on the bone surfaces, so under the periosteum. Now this is in your epiphyseal plate. So this is towards the articular surface. You have cartilage resting zone, then a proliferation stage. Then if you look at these cells, are starting to get bigger or hypertrophy. Then they start to die and they become calcified, and then you get true bone formed here. So that's ossification zone. Now, bone is regulated by several things. One is growth hormone. It stimulates epiphyseal plate activity, so you grow. Thyroid hormone modulates activity of growth hormone. Without thyroid hormone, you're going to be dwarfed. And also it has many other factors in the body. We'll talk about that when we do the study of hormones. Now, testosterone and estrogens, your sex hormones at puberty, initially cause a growth spurt, and then they close the epiphyseal plates. So here we have a male and a female. Most of you can tell which is which. Okay, the female is much shorter than the male because she reached puberty first, took a growth spurt, probably middle school age, and he still was prepubertal then, on somewhere up in high school, depending on the individual. He starts to grow and continues to grow until his epiphyseal plates close in response to that testosterone. Bone deposit is bone is deposited wherever bone is injured or strength is needed, or if you're getting growth. And to grow bones, you have to have protein, vitamin C, vitamin D3, vitamin A, calcium, phosphorus, magnesium, and manganese. Bone resorption takes place because of lysosomal enzymes from osteoclasts that digest the organic matrix, and then the osteoclasts also secrete acids that dissolve calcium salts, and then they're transcytosed across the osteoclast, go into the interstitial fluid, and then into the bloodstream. Now, control of bone remodeling is both under hormonal and mechanical or gravitational forces. Now, calcium is necessary for nerve transmission, muscle contraction, blood coagulation, secretion by glands and nerve cells, cell divisions, and we could add here life, just life in general. You've got to have calcium. That's wrong to read, but that says life. Okay, now, if you don't have the right amount of calcium, if you have too much, it will cause the heart rate to go haywire and you will die now. It will get fast, fibrillate, and you'll die. If you don't have enough, you'll not have adequate muscle contraction for respiration. In the human species, you get seizure type activity, so a spastic paralysis, or finally flaccid paralysis and death. The heart will slow. So both will kill you. Okay, parathyroid hormone responds to decreasing blood calcium levels. If you don't have enough calcium, parathyroid glands secrete parathyroid hormone. Parathyroid hormone stimulates osteoclasts to degrade bone matrix, and calcium is released, and you get increased calcium levels. And this is showing where your parathyroid glands are. You may have up to 4 on each side. And this is your thyroid gland. This is the back side we're looking at. So if the thyroid gland is removed, or if you get damage to these parathyroid glands, it's incompatible with life, because you have to be able to keep your calcium up to normal. As it falls, parathyroid hormone degrades bone, blood calcium comes back in per ml, which is, in the normal range. Okay, calcitonin is also affects blood calcium. If the calcium gets too high, thyroid cells within the thyroid gland called parafollicular cells secrete calcitonin, and that causes osteoclasts to deposit bones, calcium salt, so bone is deposited. Without your thyroid gland, you can live just running on the parathyroid glands, but you cannot live without the parathyroid glands. Wolff's law states that bone grows or remodels in response to the forces or demands placed upon it. So if you do not use your bones, exercise them, if you put them in a cast or sit in a chair, then your bones will become weaker and weaker. You need exercise to keep the bones up to strength and thickness. Okay, classifications of bone fractures. They may be non-displaced, the ends stay together, or displaced, the ends are out of alignment. They may be complete, the bone is broken all the way through, or incomplete, not broken all the way through, such as a green fracture. We also look at the orientation of the break along the long axis. They may be linear, which is parallel or with the long axis of the bone, or they may be transverse, which is perpendicular to the long axis of the bone. And also whether or not the bone penetrates the skin. This is so important. Simple or closed fractures, you have no risk of infection because the skin is covering these fractures. Compound fractures are an emergency because the bone is penetrating the skin, you have risk of infection, gangrene, and death of your patient. So you must treat these as an extreme emergency. We also talk about types of fractures by location, external appearance, nature of the break, and we're just going to look at a few. Comminuted fracture, you have bone fragments into 3 or more segments, and it tends to be common in older people. An issue is getting these to heal, because you can get a little chunk or called a sequestrum of bone that blocks the process of healing. This is a compression fracture, also common in older people. This is in the back, and this is why a lot of older people get shorter, because these bones are crushing down. Their spinal cord still functions, but they have pain, as well as their back may become shorter, as well as they may not be able to keep an upright posture. This is a spiral fracture. An issue with this is it's hard to keep this from moving without surgery. Epiphyseal fracture, right at the epiphyseal plate. In children, this is an extreme issue, because if it does destroy that epiphyseal plate, growth can stop at that epiphysis. A compression fracture or a depressed fracture here, I meant to say depressed. This is a skull fracture, and you get a skull fracture here, it pushes in, you get bleeding here, subarachnoid bleedings, subdural bleeding, everything just bleeds, pushes down, and kills part of the bone. There's nowhere for it to go. The bone can swell in response to that. You get edema, can destroy part of the brain, or the brain can completely go through the foramen magnum. As the brain starts to go through the foramen magnum, you die. Green stick fracture here is just a partial fracture. If this is stabilized and it's a child, it should heal very quickly. If it's not stabilized, it may go ahead and become a complete fracture. Okay, bone healing, you have a fracture. First place, you've got to get the 2 ends together reasonably closely, and this has got to be stabilized, because if it's unstabilized, say you get all the way to this stage, it becomes little. You're back to stage 1. Stage 1 is a hematoma, or a big mass of blood, a lot of vascularity, and then it solidifies, and then within that you get a fibrocartilaginous callus forming. Again, this is not terribly strong. If it fractures, if this is displaced, you go right back to step 1. Then you get a bony callus formed, and eventual complete healing. Now, osteomalacia and rickets are essentially the same disease, but with rickets, this is for children, a childhood disease, and they get bowed legs, bone deformities. And with osteomalacia, it's an adult onset of disease from malnutrition as an adult. Causes of rickets and osteomalacia: vitamin D3 deficiency, and our children are not getting out in the sunshine enough, and most children don't get enough D3. Insufficient dietary calcium, or a calcium phosphorus imbalance. If you have more than a 1-to-1 ratio of calcium to phosphorus, as in more phosphorus than calcium, you have a relative calcium deficiency. Now, as we look, we have good sources of calcium. Milk, this is broccoli, some kind of greens, maybe collards, spinach. These are good sources of phosphorus. See, says phosphoric acid right there. All these cereals, any types of grains and cereals. Now, and with my kids, it was much easier to get them to drink Coca-Cola and Lucky Charms than it was to get them to eat collard greens. So if you don't get enough calcium, or your kids don't get enough calcium, you need to take a supplement. It can be something as simple as Tums. Okay, with rickets, what is going on is this child is hormonally ready to grow, and so the cartilage starts forming and trying to grow, but there's no calcium to fill in the gap, and so the bones start to bend, break. You get, especially at the joints here, you're going to get bulging, bowing leg, Now with osteomalacia, it's the same thing has happened in an adult. If you look here, you have your pubic symphysis displaced. This ischial area is totally eroded. Erosion here, erosion here. Looks like erosion. Complete hole in the bone here, a fracture here. This person is not going to be mobile. And this is just simply the same thing as rickets, but in an adult. Now, osteoporosis is the same basic issue. Loss of bone mass, bone resorption outpaces deposit, and it tends to affect the spongy bone of the spine and of the neck of the femur, and they're very susceptible to fracture. So many people, we say, oh, they fell and broke their hip, which is specifically going to end up being the neck of the femur, when actually they broke their hip and fell. It's got the wrong order here. Causes lack of sex hormones. The original document said lack of estrogens, but men continue to have testosterone until they die. I say till 2 weeks after death, but that may be a slight exaggeration. A lack of calcium or a calcium phosphorus imbalance, just like with osteomalacia and rickets. Vitamin D3 deficiency, petite body form, genetics, immobility, because back to Wolff's Law, if you don't get up and move, you're going to lose bone. Low thyroid stimulating hormone, resulting in low thyroid hormone. Diabetes mellitus. Now, who gets it? Old people. Generally females, because after menopause, they don't produce estrogens. White or Asian women are much more susceptible than black women are, because black women have better genetics for bones to start with. On average, they have a much larger bone, thicker bone, stronger bone, and it's just heritage, genetics, and luck of the draw of who your parents were on whether you're likely to get osteoporosis. A lack of exercise. This is something you can control now. Even as a 20-year-old, you need to get some degree of exercise. You need to get D3. If you don't get sunshine, you need a D3 pill. Lack of calcium in the diet or a calcium phosphorus imbalance. Other nutrients. If you don't have protein, vitamins, your bones are going to deteriorate. This is normal bone. This is osteoporotic bone. Treatment and prevention, calcium and D3 supplementation. Fluoride supplement is controversial. We put it in city water here in the States. In the UK, it's considered to be a toxin. So I know we have nicer teeth on average than they do. Weight-bearing exercise throughout life, and that's very important. Take a walk, do something, pick something up. Hormone replacement therapy. Now, the problem with estrogen replacement is it also tends to cause it causes mammary cancer as well as uterine cancer, or can cause it. It increases your chance. There are drugs available that you could give seniors to prevent bone loss. Developmental aspects, nearly all bones are completely ossified by age 25. Bone mass starts to naturally decrease in the 4th decade. So when you turn 40, you got to work harder to keep your bone and muscle, while we're talking about it, mass going. That's going to require exercise and proper diet. Genetics, you can't really do much about that. Environmental factors, you can do that, as in exercise, eat the right diet. In old age, no matter what, bone resorption predominates over bone formation. However, you can definitely decrease that problem with diet and exercise. This ends chapter 6. Thank you.